Good evening. My name is Dr. David Doman, and welcome to another edition of House Call. Our topic tonight is colon cancer screening and viral hepatitis. My guest tonight is Dr. Joyce Koh, a noted gastroenterologist here in Montgomery County. Dr. Koh, welcome to House Call.
Thank you so much for having me.
My pleasure. Briefly tell our viewers about your professional background.
Well, as you know, I've been here in Montgomery County for 5 years as a gastroenterologist at Montgomery Gastroenterology, doing general gastroenterology and hepatology. Prior to that, I was doing my training for GI at Johns Hopkins in Baltimore, as well as my residency prior to that. And I hail from Pennsylvania. I went to undergrad at Harvard in Massachusetts.
Very distinguished background. So briefly, Joyce, tell our viewers about the spectrum, the severity of colon cancer in the United States.
So colon cancer is the third most common cancer in the United States, so it really takes a toll and creates a great burden. Every year, about 50,000 Americans, unfortunately, will die of this cancer, which can be detected before it's too advanced. So certainly it affects the lives of many Americans.
Now, many of our viewers may say, well, I don't want to get screened unless I have symptoms of colon cancer. Yeah. First of all, what are some of the potential symptoms and signs of colon cancer?
So when you have symptoms of colon cancer or signs that are suspicious for colon cancer, unfortunately, oftentimes the cancer is quite advanced. So colon cancer is unique in that when it's early on, it can be caught and cured if it's detected at that time. So when patients come in and they're already suffering symptoms like changes in their bowel habits, for example, possibly constipation, diarrhea, they may see blood in their stools, they may be straining, or they may have new abdominal pain or weight loss that's unexplained, then actually at that point we're quite alarmed.
All right, so it's better then to pick them up early.
Absolutely, and it is very possible to find colon cancer early, which is the really amazing thing about the technology that we have today.
If it's picked up early when they have no symptoms, are they more likely to be cured?
Absolutely. So there are curative surgeries. Sometimes people do not even require chemotherapy, which naturally people think about when they think of cancer treatment. So with surgery, people can be cured and they go on to lead completely healthy lives.
Is colon cancer screening recommended for everybody?
Absolutely. So at this time, we're recommending for adults ages 50 plus, and actually American Cancer Society recently came out with a recommendation that individuals 45 years older and above should be screened for colon cancer. Now, of course, as you get a little bit older, it may not make sense, but we're talking maybe around 75, 80 years of age, and you may not need this test, but again, for healthy adults 45 to 50, they really should be thinking about, have I had this test, and think about talking about their doctor if it's not been brought up already.
Now, aside from the fact that everybody needs to be screened for colon cancer, what are some of the risk factors for developing colon cancer?
So people often, actually one of the first things people often tell me are that they may not have a family history of colon cancer. And it is true that having a family history, for example, a first-degree relative or multiple second-degree relatives with colon cancer, that your own risk goes up because of the genetics of the cancer. However, there are other risk factors. Certain ethnic groups, African Americans, people of Ashkenazi Jewish heritage, are increased risk than the general population. But we also see lifestyle factors: smoking, heavy alcohol use, obesity, inactivity, and then also dietary factors such as a low-fiber diet and a diet that may be overly heavy in processed meats or red meats.
And I should interject for our viewers, when you say first-degree relatives, you mean close relatives.
Right, so just to break it down, a sibling, your mother, father, or, well, obviously child, those would be people to think about. And also looking at their age. So colon cancer, the risk goes up with aging. If you have a family member who is particularly elderly, you may not need to be alarmed, but again, it's still something to talk about with your doctor to kind of assess your risk. And again, even without any of these factors, you want to be thinking about it when you're in the 45 to 50-year old range.
Now, you mentioned the revised criteria, the age criteria, that at least one society has recommended to begin screening at age 45 instead of 50. Why is that?
So, unfortunately, we've actually seen in recent years that colon cancer is not just a disease of the elderly or older population, but it's been unfortunately striking younger patients under 50, even under 40. And this is an area of active research to see why is this trend happening, because it used to be in our minds, even as physicians, that unless you're of a certain age, you don't have to stress about colon cancer. But there are indeed statistics showing that there has been a rise in younger patients. So American Cancer Society is hoping that by making the recommendation to start at age 45, that they'll catch more cancers early on.
Okay. So now that you've made the compelling case that people should be screened for colon cancer, let's then explore what the different options are to provide that screening. Share with us some of the stool and blood tests that are available.
Okay. So yeah, the great news is that, you may have heard from a friend, maybe a test that they did, and you might think that's not for you, but there's a menu of valid screening options. So we say, there is no best test, so to speak. There's certainly different qualities, so you need to make an informed decision, but it can be simple as submitting a stool sample. There is a company that can send you a kit where you do this in the privacy of your own home, and you submit your stool for processing. And what they're checking for is any hidden blood. So absolutely perfectly normal stool can shed blood and also abnormal DNA, which can be an early sign of colon cancer. So that's one type of test. There's also traditional stool tests that some people are more familiar with, where you use a small swab maybe to collect a small amount of your stool. And there's also a radiology test. So whereby you would do a preparation to clean out your colon, but then you would have X-ray imaging or CT imaging done to look inside the bowel. And then of course there's colonoscopy, which I think many people are familiar with, which is an internal examination done under anesthesia by a gastroenterologist or sometimes colorectal surgeon to visualize the inside of the colon. There are some blood tests that have come to light, but they're not routinely recommended. So they're still under some investigation. That may be a wave in the future for something even more simple than submitting your stool as a valid menu option.
Right. Circling back to each of these tests, the first test that measures the stool DNA in the blood, that's the Cologuard test.
Right.
From Exact Sciences. They advertise it on television now. What have you found are the negatives about that test?
So there is a fairly high, what we call false positive rate. So about 9 to 10% of the time, a patient's test result is going to be coming back as positive. Now, when you get that result, you don't know whether that's cause for alarm in terms of that means that there is a cancer present, or simply a precancerous growth such as a polyp, or that there really is nothing unusual going on in the colon. However, once you get that positive result, you're obligated to do a colonoscopy to ensure that there is no growth in the colon or cancer in the colon. So you absolutely need to follow up with that. And during that waiting time, it can be a little bit anxiety provoking for patients to wait and wonder if there's something going on or not. So that would be, a downside of it. And it is quite good for ruling out cancer, but it can still miss some cancers. There is no such thing as one perfect test, and it is quite good to cross out colon cancer, but it can still miss some cancers.
Sure. And then in terms of the X-ray, the virtual colonoscopy, what do you find are the negatives for that?
So for that one, kind of similarly speaking, if something is found on the CT, then you'll have to repeat your bowel preparation, the so-called clean out. So that obviously is probably a downside for most patients and then undergo the internal examination. It is quite accurate for growths of a certain size, but may miss some smaller things or flat polyps, which still can be precancerous in the right side of the colon. So it's a very good test, but again, it can lack some sensitivity or accuracy. And there is some radiation exposure. Sometimes other growths elsewhere in the body could be detected, and some of those things are actually not of concern, but when little spots and lumps and bumps are found in other parts of the patient, that may lead to further testing that's not necessary.
Sure. So let's go on to discuss colonoscopy, which is the state of the art in terms of diagnosis and, if necessary, rendering therapy. When we do colonoscopy, we're not, of course, just looking for cancer. We're looking for precursors, potentially, of cancer, so-called colon polyps.
Right.
Explain to our viewers what exactly is a colon polyp.
Okay. So a colon polyp is a cluster of abnormal tissue growth or abnormal cell growth. Again, so I kind of liken it to maybe someone who's had a lot of sun exposure. They may have like a mole on the outside of their body, which they can see. In this case, though, these lumps and bumps on the inside of the colon, they start out very small, so they have absolutely no symptoms. However, some of them do continue to grow over the course of years and can transform into a colon cancer.
If you do a colonoscopy and you find a polyp or polyps, what do you do then?
You know, colonoscopy, although it may be an investment of time and some of their resources, it's a preventive examination for some patients. So in about 30 to 40% of patients, we may detect these growths. And while we're doing their examination to look for colon cancer, if we run into a polyp, if we detect a polyp, we can, by and large, unless that polyp's extremely large or unwieldy, go ahead right then and there and remove the growth, and thereby actually prevent colon cancer. So it's kind of, you know, the one-stop shopping in a way. So, and this also, you know, this tissue is submitted to the lab for analysis, pathological analysis, and depending on the type of polyp, it also helps us to tell the patient what is your risk of making new polyps in the future. And yeah, I think it's really a unique aspect of colonoscopy.
So it's one-stop shopping, as you said.
Pretty much, so to speak. Yes.
Is this procedure usually done as an outpatient in a facility or in the hospital?
Okay. So the great news is that this has become a one day outpatient, what we call ambulatory test. So you're not going to be admitted to the hospital. You're not going to be there for hours on end. For example, at my endoscopy center, you'll come, check in, be prepped. You get an IV. You'll meet the anesthesiologist, have your test, and once it's done, you wake up naturally on your own, and as long as you have someone to take you home that day, because we don't advise any driving after that, then you're good to go. So the whole process takes a couple of hours, and then you have results that might carry you through the next several years, maybe up to 10 years if nothing is detected. So it's really worth the investment.
Now we have 1 minute before we go on to the break. Of course, our viewers are wondering, is colonoscopy covered by Medicare and most private insurance plans?
Yeah. So yes, private insurances, Medicare, they are on board because they want to help to prevent and detect problems early on. So if you're of the age, you're definitely eligible to undergo any one of these screening tests.
Terrific. Now we'll pause for a public service announcement. We'll be right back.
150 over 90.
180 over 111.
160 over 110. I had a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a stroke are far from invisible or silent. If you've come off your treatment plan, get back on it, or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
If I would have followed a treatment plan, I would not be in this situation.
Once there was a boy who did the same thing again and again. One day, he was told he had autism. He got help and slowly learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
We're back. My guest this evening is Dr. Joyce Koh, and we will now be discussing viral hepatitis. Joyce, we're going to shift gears now to discuss a very important topic as well, which is viral hepatitis. Let's first look at hepatitis B. How common is hepatitis B in the United States?
So we think that probably about 1 million of Americans have hepatitis B, but it may be as much as 2 million because we do see it in a good number of immigrant populations. And in many patients, it can be a chronic disease.
And how much of a problem is it globally?
So in certain parts of the world, it is a major problem. In parts of Asia and Africa, it's a leading cause of liver cancer and death.
So if somebody has hepatitis B, how is it typically contracted?
So it can be contracted in infancy. So mother-to-child transmission is one area that's difficult for, to break the chain, so to speak, in terms of viral transmission. So unknowingly during childbirth, because it is transmitted through body fluids, blood, semen, sometimes saliva.
And what about drug abuse? I mean, our
Right. So
viewers are
yes,
wondering.
that absolutely ties into anyone with history of needle sharing, or even like piercings that are done or tattoos, and then also even intranasal or snorting of illicit drugs can expose you to hepatitis B.
Somebody contracts hepatitis B. What happens then? Is it a self-limited illness, or does it go on to chronicity?
Yeah. So this is a fascinating virus. It's very interesting. If you're exposed to it in infancy or childhood, unfortunately, you may not be able to fight off the virus, and it becomes chronic and causes this chronic infection, inflammation in the liver. A good number of adults, maybe 25 to 50%, who are exposed, their own immune system may be able to contain and control the virus, and so they will not have ongoing symptoms or infection. So it kind of depends on when you're exposed and also maybe what other kind of medical problems you have. So if you have HIV, you may be more likely to have chronic hepatitis B along with that.
Okay. Somebody goes on then to develop chronic hepatitis B, either during childhood or during their adult years. What kind of symptoms, if any, do they present with?
Yeah. So it can run the gamut. So some are completely unaware. They have no symptoms. Others may have maybe symptoms of fatigue, or on routine testing may have a slight increase in their liver function tests. When it's severe, there may be symptoms like jaundice or yellowing of the skin or eyes, changes in the urine. If it's very progressed, then it can cause symptoms of liver failure, which any kind of cause of liver failure, if you're that advanced, can cause things like fluid in the belly, abnormal swelling, confusion, abnormal bleeding.
And aside from those sort of signs and symptoms of end-stage liver disease, with the liver is failing, you'd also mentioned there is a long-time risk of liver cancer.
Right.
Okay. So given that their patients can have no symptoms and little or no changes in liver chemistries, which sort of patients do you then screen for hepatitis B?
Okay. Yeah, so patients who are from certain ethnic backgrounds or from certain countries, so parts of Asia, Africa, they should be checked. Parts of South America, they'll want to be screened. Or possibly if you grew up in a household and that's your family background, just because the virus can live outside the body for up to a week. So, and people, if you don't know that you're a carrier of the virus and there's an accidental blood spill, it could be transmitted. And then certainly, of course, any pregnant woman should be checked for the virus because during natural childbirth, that's a time of transmission.
Okay. So if you diagnose hepatitis B in someone, what do you do next?
Okay. So you want to take a look and see, okay, is the virus actually causing damage to the liver, or is the body to some extent naturally, so to speak, controlling the virus? So depending on what you look, and mostly this is done through blood tests and then imaging tests, sometimes liver biopsy, a needle sampling of the liver to get a bit of tissue is helpful as well. So once you're able to determine where your patient stands, then you may want to offer treatment. Now, the treatment is not a cure as of yet. Researchers are working on a cure for this virus, but there is very good treatment that suppresses the virus to almost undetectable levels, and thereby, protects the liver from further damage and greatly decreases the liver cancer risk.
And what exactly are some of the options that are out there?
So there are pills that you can take once a day, trade names of Viriad, Vemlidy, Baraclude, and these are very well tolerated. Patients, they almost don't realize that they're on it. Aside from some monitoring, blood tests, sometimes some other additional tests, patients can be on this for years and again, tolerate it very well, and they really do very well because of that.
And are these pills covered by insurance?
So most insurances do cover. The cost can vary because of different drug pricing, but some have become generic over time, so making them more affordable. Because we do understand that this is a pill that once we start it, often we don't stop it. It's lifelong, so we are very considerate of that for patients. So we never want price to be a factor, and oftentimes we can work with assistance programs. So someone with hepatitis B, if they've been told they need to be treated, they should not hesitate to continue to try to follow up, because that's what's going to really prevent them from future problems like liver cancer, where it may be too late and they will suffer a lot.
And it sounds like what you're really recommending is to use this for the number of years just to bridge the gap until a cure is found.
Right, yeah.
Let's go on then to discuss the other important virus, which is hepatitis C. How does hepatitis C differ from hepatitis B?
Right, so hepatitis C, the risk factors for transmission are a little bit different in terms of exposure. More often is associated with IV drug use or intranasal drug use. Sometimes sexually, more often men who have sex with men, not as so much through heterosexual sex. And then for patients who may have had blood products before around 1987 to 1992, that might be a more often cause to have it if you're here from the United States. And then in other parts of the world, it's more common in the Mediterranean basin, parts of Africa, parts of Asia.
What are the symptoms of hepatitis C?
Oh yeah. So these liver viruses are fascinating. Often some patients go for years, unfortunately, until they're detected with what we call cirrhosis, which is a scarring down and hardening of the liver from years of just injury and being battered by the virus. So they really say they feel fine until maybe they fall ill, maybe they're bleeding, or they have abnormal swelling, or they're jaundiced. Or maybe you go into for a routine check and they say that one of your liver numbers is a little bit high. Often there aren't really a lot of symptoms when you first get exposed to the virus, so even if you had an encounter with someone who had it, you may not know. It's not like you're going to walk away or a week later say, oh, maybe I think I've been exposed. So that's the little bit tricky and frankly scary part of this virus. Mm-hmm.
Now, the Center for Disease Control is now making a big publicity push that baby boomers, and in particular Vietnam vets, should be screened for hepatitis C. Why is that?
Yeah, so I talk to my patients who are in this 1945 to 1965 birth year range, and understandably, most of them say, I've never touched a drug, I'm afraid of needles. But interestingly, in this age group, because we just know that hepatitis C is more prevalent, so whether you're aware of your exposure or not, or you have any of those risk factors, we just know there's more likelihood. And for that reason, even without any perceived risk factor, you should get screened at least once. And that can be done with your annual visit with your primary care physician. It's a simple blood test that goes along, with your cholesterol check.
Sure. Mm-hmm. And if the blood test screen shows that there is hepatitis C, even if they have no symptoms, what is your next step?
So you always want to confirm. There can be exposure, and some people do clear the virus on their own. Their body handles it, and it's just a mark that they were exposed in the past. But if they show that they have active viral load in the body, then again, similarly to sizing up your patient with hepatitis B, you want to look for any signs that maybe there's become scarring in the liver, damage to the liver, so you could see how advanced the course of the virus is. Now, The recommendation actually is, though, however, even if there is no scarring seen, and your patient's been very fortunate to do well despite that, that you want to treat, because the difference between hepatitis C and B, for what we have right now, medically speaking, is that there is a cure for hepatitis C.
What are some of the medicines that are currently available to cure hepatitis C?
So again, kind of similar to the hepatitis B treatment, suppressive treatment, there are pills that can be taken, maybe 1 to 3 or several pills a day, for as little as 8 weeks at a time. And patients may have seen these commercials for so-called medicines like Harvoni. These are antivirals, Harvoni or Mavorite. So these have all come, to the forefront in the last several years. So really amazing wonder drugs, because I think for patients who know about hepatitis C from the past, they were used to having to take combinations of injections and pills that really made them unfortunately feel lousy, had a lot of side effects. But these medicines, again, some patients don't even, feel any side effects during that time, and when they're finished, the virus is truly cured.
So with these new drugs that have only been released in the last 1 to 2 years, what is the projected cure rate for hepatitis C?
Oh, 99%, I would say, is what I tell my patients, to expect good results. The incredible thing is that even for patients who might not reach that, cure, there are still actually now even options for second-line treatments if, they are maybe that 1 or 2% who didn't respond to the medication despite taking it properly. So really, it's just like a whole new era.
So these new pills have fewer side effects and shorter duration, with a much higher cure rate.
Oh, yes, yeah.
Are these new wonder drugs, so to speak, covered by insurance?
Yes, so many private insurances do cover the cost of medicine, because these being these so-called wonder drugs, the cost is anywhere from $26,000 to $84,000 plus a year. So insurance, fortunately, has seen the light in terms of saying, look, if we can get rid of this virus now, we're going to prevent a lot of problems later on. For other patients who might have medical assistance, insurance is asking for patients to wait to be treated until their liver disease is maybe a little bit more progressed. But we're working on it, hoping that they will change those rules so we can continue treating and cure and just stamp out this virus once and for all.
Dr. Ko, we are out of time. If our viewers have any questions, how can they reach you?
Well, I practice right down the road in Silver Spring, so my office contact number and website are listed, and so be happy to field questions, maybe even in the office setting for consultation one-on-one.
Thank you for joining us on House Call.
Absolutely. Thank you so much for having me.
My pleasure. My thanks to Dr. Joyce Ko for a very informative interview on colon cancer screening and viral hepatitis. My thanks to the terrific team here at the studio, and most important, my thanks to you, the viewer, for welcoming us into your home. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, Dr. Adam Spector, a noted podiatrist, will be discussing foot and ankle issues. It's going to be an important show. See you then next time for another edition of House Call. Good evening.